Hi, I'm Deb Kimmett, and this is the news brief for March 28th, 2022. In this video, we cover the developments that have occurred over the last month that pertain to massage therapists. This month, we'll cover the CDC's new guidance on monitoring community levels, updates on the variants, a bit of an update on long COVID, and other miscellaneous news gathered over the last month. We'll begin our usual way. A shout out goes to the Massage Health Practitioners and COVID-19 Facebook group. They provide accurate, evidence-informed info, and I want to credit them for a job well done during the pandemic. They're just one of many sources that I use to gain information for these news briefs. You'll notice at the bottom of the slides I have an abbreviated source. The full citation is in the companion PDF file. And before we get into the topics for today, remember, science changes, so what we know today may not be what we know tomorrow. This means that the information presented here will evolve and change as we learn more. First up, the CDC's new guidance on monitoring community levels. In the blink of an eye, it went from this, where masking was recommended for pretty much everyone and 95% of counties in the US were considered high risk, to this, where 70% of the US no longer needs to wear masks and only 30% of Americans are in areas considered high risk. What changed? You'll notice that it's no longer called community transmission levels, just community levels. This means that before, the CDC emphasized the spread or transmission of the virus. Now they aren't. Instead, what the CDC does is put the focus on transmissions in the back seat, and has increased the emphasis on hospitalizations, the number of new COVID admissions, and the percentage of beds occupied by COVID patients. This new emphasis is designed to ensure that hospitals are not overwhelmed. And on the topic of hospitalizations, the CDC has broadened the definition of hospitalization to include those hospitalized for COVID and with COVID. Jetelina adds a third category, conditions exacerbated by COVID. All these categories are different, and they all need to be considered because they all impact healthcare systems. So let's take a quick look at the guidelines. It's divided into 3 levels: high, medium, and low risks. The old system had 4 levels. And this system uses case numbers to determine the number of admissions and percent of beds occupied. For example, if the case numbers are fewer than 200, then the number of admissions can be higher than if there are 200 or more cases. As you can see here, for the number of admissions to be considered in the high category, that number is much higher when there are fewer cases than when there are more cases. And you'll note that you can't even get into the green or the lowest risk level until there are fewer than 200 cases. As far as masking goes with this system, wear a mask when the risk is in orange, talk to your healthcare provider if you're high risk when in the yellow, and take off the mask in green. But the main criticism of these guidelines is that they move society away from a public health response to individual responsibility. As one public health director puts it, it is public health's job to protect everybody, not just those people who are vaccinated, not just those people who are healthy. Instead, what these guidelines do is put the responsibility onto the most vulnerable that they have to protect themselves rather than on all of us as a society. So let me go through some of the problems with this. The list is pretty extensive. The first problem is that it leaves the most vulnerable behind to fend for themselves, such as the immunocompromised and other high-risk individuals. And that includes those who are high risk because of their age or occupation, like massage therapists. Kids under 5 who can't get vaccinated, people who can't be vaccinated, and others. This system puts those folks at risk, so they'll be the first ones hit when new surges occur. The guidelines' focus is solely on severe disease and keeping hospitals from being overwhelmed. The guidelines aren't clear enough. For example, you need to have a plan for testing. Well, how can you when tests aren't readily available? It says talk to your healthcare provider, talk to your doctor. What happens when you don't have one? And it says to consider masking if in close contact with high-risk people. Really? Consider it? and it doesn't consider the impact of long COVID. And remember, even those who don't have a severe case are at risk for long COVID. Not enough are vaccinated and boosted. And these guidelines are not designed to stop or slow down a surge, since it's not based on transmission, but on hospitalizations, which is too late of an indicator. And for universal masking, the number of cases are more than double what the old number was. We're going from about 100 to 200. So where did this new number come from? The CDC doesn't justify the number, and it's pretty high. To sum it all up, the attitude of the CDC seems to be, well, as long as we have room for you in the hospital, have at it, you're on your own. So who's against these new guidelines? 400 public health and education experts thought it was too soon to lift the indoor mask mandates because it puts kids in danger. The president of the American Medical Association, Gerald E. Harmon, said that we should keep masking because there are places that everyone, including those at risk, must go to, like pharmacies and grocery stores, and we should continue to protect the most vulnerable. The largest nurses union, National Nurses United, calls the guideline change politically motivated and will, quote, create confusion and public distrust, unquote. They echo many of the concerns I've already mentioned above. Over 100 disability groups and advocates wrote to the CDC to complain as their constituents are vulnerable. And even some officials in the CDC were, quote, nervous about changing the guidance. It should also be noted that these new guidelines didn't include transportation, meaning that mask mandates on public transportation and air travel were kept in place, at least until March, and then later on, this deadline was extended another month to April 18th. The justification used is because transportation reaches geographically across areas with different risk levels. Some areas have a high risk of COVID spread and others have a low risk. And transporting people from different risk areas together is an issue. So this mandate addresses all of that. But we'll see when that mandate gets lifted. The massage therapist takeaway for all this: the CDC guidelines are very controversial. They're focused on hospitalizations and severe COVID and are not focused on spread, which puts the vulnerable at risk. So that makes it decision time. Are you more interested in getting rid of your mask, or are you more interested in protecting you, your family, and your vulnerable clients? If your priority is getting rid of masks, then follow the CDC guidelines. If the priority is protecting people by mitigating spread, don't follow the CDC guidelines. We suggest that you follow the protocols by Jedalina et al. That we discussed last month. And you can find the video of that discussion at this link. On to our next topic, free COVID tests. There are more free tests available. Originally, you could order 4 free tests, meaning 2 boxes because they come in pairs. But during the State of the Union address, President Biden said that households can order 4 more. So to do that, go to www.covidtests.gov to order them. The massage therapist takeaway: get more tests. Our next topic is to update the variants. Let's start with the BA.2. First of all, BA.2 is a subvariant of the Omicron virus. After last month's news brief, the World Health Organization released a statement that BA.2 is no more severe than BA.1, which is the original Omicron, and that BA.2 will not get its own Greek letter. Recent data from the CDC shows that BA.2 is up to 30% more contagious than the original variant BA.1, which, when coupled with people unmasking per the new CDC guidelines, could lead to a surge. Also, as of March 22nd, the CDC said that 35% of infections in the US were from BA.2, whereas it was 22% a week earlier. So we're getting more cases. But some good news about this is that getting infected with BA.2 after having had BA.1 is rare. This means fewer people can be reinfected. The bad news is that this still means that 55% of Americans can still be infected. But as far as whether we'll see a surge, there's no clear thinking on this. Some say later in the year. Jedalina thinks we'll have a surge in April or May, with the peak number of cases depending on the new CDC guidelines and people's behaviors. One thing we do know is that the US has been following the patterns that have been occurring in Europe more so than in Asia, mainly because, like Europe, the US doesn't do the lockdowns and other mitigation efforts that Asia does. So it's likely we'll follow Europe, which means we'll probably have another wave. We just don't know when for sure. The massage therapist takeaway: there's no need for outsized concern for the BA2 subvariant. Just follow your usual precautions because the vaccines work and it's no more severe than BA1. We're not sure when another surge will hit, maybe in April and May, maybe not till later in the year. Just be aware, keep an eye on the numbers. And then we have the Deltacron variant as well. The World Health Organization recognizes it and it's in the United States, but so far does not represent that many cases. It's what's called a recombinant, meaning that the two variants infect the same cell, and when it replicates, the genetic material combines. It appears that Deltacron copies the Omicron spike protein, which makes it likely that those previously infected with Omicron and those vaccinated should be okay, that the vaccines will work against the recombinant. Also, it's not really caught hold, which means that it's probably not as transmissible as the Omicron subvariant BA2, which we just talked about and which we talked about in the last news brief. So it's unlikely to overtake BA2. And it doesn't seem more severe. All in all, it probably won't amount to much. So far, it's not risen to the level of getting its own Greek letter. The massage therapist takeaway: like BA2, there's no need to be overly concerned about Deltacron. Just follow your usual precautions because the vaccines will work. Deltacron is no more severe than BA1 or BA2, and Deltacron is not likely to overtake BA2, meaning that it's not as transmissible. And this just in, it's looking more likely that the Biden administration is going to approve a second booster for anyone over 50 sometime very soon. The FDA Advisory Committee is meeting April 6th. This would be for the two mRNA vaccines, the Pfizer-BioNTech or Moderna vaccines. But there have been some behind the scenes meetings, so the FDA approval could come sooner. Some are saying even as soon as tomorrow. The idea is that doing another booster will help if and when there's a surge before the fall. The skeptics are saying that it would be wasteful to do boosters if there's no surge, and it's not clear if the boosters would help younger people. But non-peer-reviewed data out of Israel on 500,000 people showed that a second booster significantly reduced mortality rate in people over 60 years of age over those who just had one booster. The guidelines will be that you do the second booster 4 months after your first booster. Just in general, though, a second booster is not a done deal. Remember that the FDA and the CDC both have to sign off on this. It's looking like they will, but again, things could change. The massage therapist takeaway on this: we know boosters are more effective fighting Omicron than not being boosted. And if you're over 50, keep an eye out for it. And if you can and want one, get a booster. Last month, I did an extensive video on long COVID and said that I would do periodic updates. Well, it's time for an update already. In the last month or so, a few things have come up that are really important to pay attention to. First, there's criticism over how can you treat if there's no clear name and no clear definition for long COVID. The name issue was referred to in a letter from the Long COVID Alliance to the National Institutes of Health. So far, there are two official names: post-acute COVID-19 syndrome and post-acute sequelae of SARS-CoV-2 infection. And there are several unofficial names, including long-haul COVID, long-term COVID, post-COVID conditions, post-COVID syndrome, and other names. There's other controversy with the definitions as well, because the CDC and the World Health Organization have competing definitions. The CDC considers long COVID to occur 4 or more weeks after initial infection and include those who didn't even have symptoms, whereas the World Health Organization says it's after 2 months or 8 weeks. The massage therapist takeaway: Be aware of the controversy to keep in mind that there's no settled science on this. There's also new information with regards to brain issues. There's now strong evidence in a peer-reviewed study that showed that COVID can change the brain in a way that shows up on brain scans. There's 3 things about this study that were very unusual. First, they were able to gain access to brain images before a person was infected, which most studies don't have that kind of access. Secondly, the patients ran the gamut from mild to severe COVID, whereas other studies only looked at more severe COVID. And third, the study had a control group, meaning that they were able to compare the brain image changes with changes in those who didn't have COVID. And the study showed that COVID can cause changes in the brain itself. And more concerning is that these changes also occurred in those who had mild cases of COVID, and that these changes, even among those COVID patients who were not hospitalized, led on average, quote, to significantly greater cognitive decline, unquote, as compared to the control group, but, quote, no signs of memory impairment, unquote. The massage therapist takeaway. As massage therapists, be aware that your COVID clients may have some cognitive issues. So keep in mind if they appear to have brain fog, are forgetful, or have other issues, and make sure that they've discussed these issues with their treating clinician or their doctor. We're also learning more about how COVID affects the heart. We now have a large peer-reviewed study through Washington University and the Veterans Administration healthcare system that shows that there's a higher risk of cardiovascular disease 1 year after the initial infection than for those not infected. They studied over 153,000 veterans and had 2 control groups of over 5.6 million people each. And they also found that, quote, beyond the first 30 days after infection, there was increased risk of cardiovascular disease, unquote. And this was present even for those who had COVID but were not hospitalized. Also alarming is that race, age, sex, and other cardiovascular risk factors didn't matter, meaning that a person with long COVID is susceptible to cardiovascular problems, even if they were considered low or no risk prior to infection. The massage therapist takeaway. This just puts a finer point that anyone may have cardiovascular and clotting issues, even if they previously weren't at high risk for these issues. Pay attention to clotting, stroke, and other cardiovascular warning signs, and have they discussed these potentials with their doctors and refer to a physician if needed. Something else I don't think I originally reported on, in a very large study, long COVID can just pop up later on. 40% of those who experienced long COVID symptoms 3 to 6 months after their initial infection did not have symptoms in the previous 3 months. The massage therapist takeaway for that, keep an eye out for it, watch for it. Long COVID can just pop up, and refer clients back to a physician or treating clinician for treatment if mysterious symptoms show up out of nowhere. And finally, during our discussion of long COVID last month, we talked about how diabetes is a risk factor for long COVID. Now, new data is coming out that long COVID can include the development of type 2 diabetes. So not only is it a risk factor for getting long COVID can cause diabetes as well. The more severe the case of COVID, the higher the risk. It should also be noted that while this study was done on a large cohort of veterans, the CDC has released data showing that kids diagnosed with COVID also had an increased risk of diabetes. And that's it for today. Thanks for watching. And again, please remember that science changes, so what we know today may not be what we know tomorrow. Stay safe, be healthy, and enjoy the spring.